Come in.
Hi, Mr. Mickery. How are you today?
Hi. Good.
My name is Dennis, and I'm going to be your nurse today. How are you feeling today?
Fine.
Fine. Are you comfortable in your bed?
Yep.
Okay. Before we start, is there anything I can get for you?
Nope.
Okay. Just can you do me a favor? Just state your full name and your date of birth for me.
Acting Control Mickery and 10/4/2004.
Very good. Thank you very much. I'm just going to close your curtain over here. Shh. And pardon me a minute. I'm just going to wash my hands, okay?
Hey, the doctor's got to do what a doctor's got to do.
Well, I'm a nurse.
Nurse, doctor, practically the exact same thing.
All right. So I'm going to be doing a physical exam on you today, okay, from head to toe. First thing I want to do is I want to check your pulse and your blood pressure. Is that okay?
Yep.
Okay. And do you have any major concerns today? Do you have any problems going on that you want to talk about?
Nasal congestion.
Nasal congestion. It is allergy season.
Got a point.
Okay, well, we can talk about that. I'm going to borrow your arm here. And turn your arm upward for me. Just relax. It's going to feel a little tight on your arm, okay? Blood pressure is good. You're 108/60, which is normal for your age.
That's good to know.
If I could just borrow your wrist really quick.
Okay, which one?
This one's fine.
Okay.
I'm just going to check your pulse. Okay, excellent. You okay?
Yep. Sneezing a lot in class and having to get up a lot to get a tissue in class.
Okay. Well, let's do your physical exam and then we'll talk about your allergies, okay?
Okay.
I'm going to have you just slide back down in the bed a little bit so you're laying kind of flat for me. I want to just take a listen to your belly first.
1 second. Give me 1 second to do that.
Okay.
Is this good enough?
That's perfect. Thank you. And I'm just going to lift your covers back a little bit.
Okay.
Keep it covered up. Are you having any pain in your belly at all?
Nope.
No? Okay, good. Just going to take a quick look. Looks good, okay. Nice and flat. The belly sounds are good, and I'm just going to listen to some of the arteries that come through your belly here.
Okay.
Everything sounds good. What I'm just going to do is I'm going to feel your belly a little bit. I'm going to be pressing down, okay?
Okay.
Let me know if anything hurts or is really discomfort, okay?
Okay.
Everything feels good. Your belly is nice and soft.
Yeah.
Don't feel like your liver's enlarged.
Nope.
Okay, great. All right, I'm going to have you just sit up on the edge of your bed for me. Help me here. Great. Okay, perfect. So we're going to do a neurological exam, okay? I'm just going to make sure that everything is neurologically intact. Let me ask you some questions first. So you already told me your name and your date of birth. Can you tell me what month it is?
April
What year is it?
2015.
Good. And do you know where you are right now?
The hospital,
Okay. Do you know which hospital?
St. Mary's.
Good. And let's see. Can you tell me why you came to the hospital?
Checkup.
Okay. Excellent. Very good. What I'm going to do is now shine a really bright light in your eyes, okay?
Okay.
All right. I'm going to have you look straight ahead for me. Keep your eyes nice and open. Look straight ahead. Good. Be really bright. Great. Excellent. Very good. I'm going to have you do is close your eyes for me. Right. We're going to test your hearing. I'm going to make a little noise next to your ears. And I just want you to raise your hand on which side you hear it, okay?
Okay.
Right. Good. 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 Excellent. Okay, you can open your eyes. I'm going to have you look straight at my nose. I want you to follow my finger just with your eyes. Don't turn your head, okay? Very good. Okay, and now I'm going to do is put my hands behind your head. I'm going to flip my fingers back and forth. I want you to tell me when you can see my fingers, okay?
Okay. Right here.
Good. Perfect. All right. I'm going to have you do smile real big for me. Show me your teeth. Good. Okay, you can stop smiling. Puff out your cheeks. Good. Raise your eyebrows. You need to move your hair a little bit. I can't see your eyebrows.
I'll just do this for you.
Raise your eyebrows. Good. Okay. And I want you to stick your tongue out. Very good. All right. Now I'm going to do is I want to press on your shoulders. I want you to pull your shoulders up, like you're shrugging. Good. Excellent. Okay. And then I want you to turn your head to the side and look forward and turn your head the other way. Okay. Very good. Any pain or anything?
Nope.
Any trouble with your vision? Have you been seeing things okay?
Things have been a bit blurry, but other than that, we're good.
Do you remember when the last time you saw an eye doctor was?
3 years ago.
3 years ago. Okay.
That's just a random estimate, by the way.
Okay. You should definitely see an eye doctor at least once a year. Okay.
Well, if I remember correctly, my mom was thinking about taking me to the eye doctor sometime this month.
Okay. Excellent. Very good. And any trouble with your hearing at all?
Both ears, trouble hearing.
Trouble hearing.
In class.
In class.
Yeah.
Is that because of noise or people talking?
No, everything would be perfectly quiet, and my friend would come over to talk to me to give me a handout when I need it, and be like, because I couldn't hear him.
Okay. But you're not having any trouble hearing me right now?
No.
Do you have any trouble hearing at home?
No.
Okay. Well, we'll write that down. Okay, we'll mention that. Okay. Next thing I want to do is I want to test the strength in your arms and your feet and your hands. Okay.
Okay.
So put your arms up like this. Now I'm going to pull. Don't let me pull. Very good. Now I'm going to push against me. Very good. Grab my fingers, both hands, squeeze. Good. Excellent. Now I'm going to test the strength in your legs. I want you to push against my leg. Good. Pull backwards. Excellent. Push forwards. Good. Pull backwards. Excellent. Nice and strong. Now we're going to do the same thing with your feet. I want you to pull up, pull your feet up. Bend your knees. Just, there you go. Raise your feet up. Excellent. And push down. Perfect. Okay. You got really good strength.
Thank you.
Any pain in your muscles and joints?
Teensy bit down around here and on the elbow.
Is that normal?
No.
How long has that been going on?
Ever since I just took my socks off.
Okay. So it just started now.
Pretty much.
All right. Let's see. I just want to check the temperature in your skin here. Good. Very good. I'm just going to do a little pinch on the arm, just check. Make sure you're nice and hydrated. Good. Excellent. Check the feet. Good. All right. Very good. Let's see. So the next thing I want to do is I'm going to palpate your pulses, and I'm going to take a listen with my stethoscope over your neck, and I'm going to listen to your heart. Okay. I don't see any jugular vein distension, so that's good. Do me a favor, hold your breath. Okay, breathe. One more time. Hold your breath. And breathe. Very good. Alright, sounds good. Just going to feel for your pulses. Just move your arms to the side. You have pulses in your thighs here. I'm just going to feel for your pulses. Good. And behind your knees. Very good. Just going to feel the tops of your feet here. And go behind your ankles. Good. Okay. I'm going to take a listen to your heart. Sounds really good. Hold your hands out for me. Check your capillary refill. Edema or swelling. Do the same thing on your feet. Just keep your feet flat for me. You ever have any swelling in your ankles at all?
Explain.
Like your ankles ever get real puffy and big around?
Not that I've ever noticed.
Let's see. Excellent. Next thing I'm going to do is going to take a listen to your lungs, okay? And just breathe normally, okay? Listen to your back. Deep breath. And exhale. Don't hold your breath. Okay. Deep breath. Deep breath. Deep breath. Breathe out. Deep breath. Deep breath. Very good. So, allergies. Have they been really bad this year?
Mm-hmm.
Do you take anything for your allergies?
If vitamin gummies count, then yes.
Vitamins can help with allergies because they keep your immune system
Going and everything.
right. But do you take any medicine that's specific for your allergies?
No.
So you don't take any nasal sprays or allergy pills?
No, I don't take pills yet. I just do drinks, and if I do drinks for my nasal congestion, on occasion that I do it on occasion that I need it.
So do you take
Zyrtec.
Zyrtec? Okay, good. So that's specifically for allergies.
Yeah.
Okay. Did you take any Zyrtec today?
Yes, I did.
Okay.
This morning before I went to school.
Okay. We might want to talk to the doctor and see if we can get you a nasal spray as well, since most of your symptoms seems to be runny nose, blowing your nose a lot.
Yeah, I can feel it right now. There's something down in the back of my throat.
You probably have back drip. That's when you're...
Doesn't that count as part of nasal congestion?
It can, yes. Right? Back drip is when your sinuses are filling up with fluid and they get so full that it actually starts to drip back into your throat.
And the bad thing about it is I don't have a chance to get rid of it in school. I still have a long time since I don't go to school for a long time. If you catch my drift.
I'm not sure what you mean.
I've got a while until summer.
Oh.
Summer break.
Oh, right. So you have a hard time getting rid of it while you're in school, but you won't during summer break.
No, not summer break or any time I'm in school. It's easy to get rid of it because I just have a trash can that I can go to as needed.
at school?
No, at home.
At home. Okay.
I can't do that at school.
Okay. Can you keep tissues with you at school?
They will allow me to bring tissues. I've always found that when I do bring tissues, I tend to run out of them quickly.
Can you bring a box of tissues?
No. We have a specific box of tissues in the classroom that we can only go to without our teacher specifically, or any teacher that comes in our room, permission.
Okay. But can you keep tissues at your desk?
Yes. Okay. It will allow you to bring these little packs of tissues.
There's not a whole lot of tissues in there.
No. But they will last a long time.
Okay. So maybe talk to your mom about maybe bringing a couple of packs of tissues with you that you can keep in your desk, so that you can use them and you don't run out as easily.
The only thing I've been thinking about, and I haven't talked about this with my mom already, is because where in the world am I going to put them? And like, if I just put them in my desk, they'll probably fall out because there are holes in the bottom of the desk.
I'm not sure. That'll be something you'll have to work out with your mom and your teacher.
Good point.
Alright, so you take Zyrtec for your allergies. We'll talk to the doctor about getting a nasal spray as well and see if that helps you with your back drip. Do you have any other concerns? Are you eating okay? Yeah. Okay.
As far as I know.
Right. Are you drinking okay?
I don't usually have a chance to drink at school. I mean, like, if we get lucky, we have at least 4 times to drink water at school. And it's usually not water.
What about at home?
At home, I can drink water as needed because I can just go upstairs and get myself a cup of water.
Do you drink a lot of water?
I try to.
Okay, good. That's good. Do you drink soda?
No, I do not like soda.
Excellent.
It's a fizziness in my mouth. It gives me a stinging feeling in my throat.
Okay. Alright, so lots of water, no soda. You're eating okay at home. Did you have a bowel movement today?
A bowel movement?
Did you go to the bathroom? Did you poop?
Yes.
Okay.
Twice.
Good. And any diarrhea?
Yeah.
Okay. Any problems going pee?
Nope.
Okay. Very good. All right. Any other concerns? Anything else you want to talk about?
Eyesight.
Okay.
I try and read. Sometimes when I'm sitting at my desk, I am 2 rows back from the Promethean board when the teacher is using it. She usually in social studies she usually puts paper and she writes down on what we need to write on the paper. I can't read writing. I can't read her writing very well for some reason. I know she has great writing, but I can't read it. Sometimes I get mixed too. Sometimes I mix up 2 L's with 1 U.
Does she write in cursive?
Sometimes. Not all the time, but sometimes.
Okay. Does the board look fuzzy at all to you?
Depends on perspective.
What do you mean? Do you mean how far away you are?
Yeah.
So is it fuzzy when you're close up?
Very.
How about when you're far away it's not fuzzy?
Not at all.
Okay.
It does tend to be a little dim, but other than that, it's okay.
Okay.
It's probably just problems with the light.
Okay. I think we definitely need to talk with the doctor and your mom about getting your eyes checked.
I know.
Because you might need glasses. You might just need them for reading. Does your mom wear glasses?
Yeah. Driving glasses.
Does your dad wear glasses?
Yeah.
Okay. All right. Well, we'll get an eye exam for you as well. Okay. All right. Well, I will be back in to check on you in a little while.
Okay.
If you need anything, let me know.
Okay.
All right. Do you remember my name?
Yes.
What's my name?
Dennis Patrick Mercury.
Okay. All right. You let me know if you need anything. Okay. All right, sir. I'm just going to wash my hands again here. And pull your curtain across. All right. You let me know if you need anything.
Okay.
Okay. Okay. Ashton. Sorry about that. That was my son, Ashton. So that was my head-to-toe presentation. It ran a little bit over, but there was a lot of conversation. So his assessment was fine. Cardiac, respiratory were fine. Neurologically intact. Obviously, the only thing to discuss was the allergies. So again, we talked to our doctor about getting nasal spray for the back drip. He does take Zyrtec. The vision.
That's me.
The vision, obviously, get the eyes checked with the eye doctor. Usually don't do that in the hospital, but we could mention that to parents to get the eyes checked. His blood pressure was normal for a 10-year-old. Pulse was normal for a 10-year-old. Respirations were normal. Trying to think if there's anything else. I think that was about it, really. Thank you very much for watching this, and I hope you enjoyed it. Again, sorry about it ran a little bit long, but hope you have a good afternoon, and take care.
Me too.
And Ashton will say bye.
Bye.
Thanks, Mrs. Diggs. Have a good night.
Alright, guys.